welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Dr. Brittany Lamb. Thanks for joining us today, Brittany.
Hi, thanks for having me.
Sure, absolutely. So I usually start by saying how we met. So on June 22nd, I sent you a message and I said, I found you on SoMe which I totally forgot. That's how I found you. And I said that we have some mutual connections. And you got back to me and you said, hi, Kim, happy to connect with you here at some point for a chat. To drop you an email anytime. So I thought that was so nice of you that right away, that you offered to chat. So I took you up on that and we Zoomed on August 17th. And at that time, we initiated a conversation about collaborating on an article for Kevin MD, which we did with Dr. Adam Harrison. It was called Physicians Turn Feelings of Frustration and Powerlessness into Purpose and Hope. And this is a Brittany and Kim day because we just got off of a podcast with Kevin MD and Adam. So that was a lot of fun. And by way of more formally introducing you, Dr. Brittany Lamb is an ER physician passionate about helping dementia family caregivers make confident and informed medical decisions. And today we'll be talking about Brittany's online course, Make Your Plan with Dr. Lamb. So what would you most like our audience to know about you as we begin our conversation?
Yeah, I think what's important to know is that, well, one, as you're aging, I think that you have more control over what happens to you from a medical standpoint, maybe than what you realize. And it's really important to think about what you're at risk for and kind of plan out for your future, if it matters to you, what kind of medical care you receive. I think a lot of people really value quality of life. As we age, we start to value that maybe more than length of life at a certain point. And if you don't communicate that, then it's hard to step in and make medical decisions on your behalf. So what I do is I really help the medical decision makers of people who are living with dementia, who are already in the role where they're having to speak and step up and advocate for this person, really think about, okay, what is my person most at risk for from a medical standpoint? And when and if these things happen, because a lot of things are foreseeable and we think that they will happen, what is okay and what's not okay? So I just want people to realize that they have more control if they take some initiative and learn and kind of do some steps, take some action ahead of time.
Yeah, absolutely. And as you know, I fully support and understand and with and agree everything that you're trying to do. And I had mentioned that for about 7 years, I had worked in a couple of nursing homes and saw firsthand, the issues that you're talking about. Did you want to share for those who might not have met you before, how this came to be for you? Your interest?
So I mean, I've been working in the ER. Gosh, I started in trying to think what year was it that I started working in the ER. I think it was 2014 when I started residency, right? And so now I've been in attending since 2017. And I basically, when you go through the journey to become a physician, it's just kind of like the next step, the next step, the next step. And then you reach becoming an attending. And after you've got a few years under you, I feel like a lot of physicians kind of look around and they say, is this all I've got? I could do more. I can learn more. I like to grow as a person. So for me, I started to get very burnt out in the ER. Just very, very irritated with the system and not feeling like I was really actually making a difference, which I know I make a difference, but when you're in it on a day to day, it can sometimes feel like you're not actually moving the needle. So I started to see this problem in my community, and we have an aging population. And so more and more people, unfortunately, are living with dementia, diseases causing dementia, but really just anyone who's aging. I kept seeing people coming into the ER for medical problems that were foreseeable. Because if you look at their age, you look at what medical problems they have, it's like we knew that this was a possibility. And then for me as a doctor, going to their family, okay, well, what do you guys want to do? What's okay? What's not okay? Having very limited time and some of these situations being very stressful. I found people really struggling to speak on behalf of their family members. And to me, I think that we can do better. So
Mhm.
I think that there's not enough time in these interactions to teach people and to give them the space to learn. So I decided to come online and start teaching, and then I created a program that people can go through, a step-by-step program for how to be a decision maker and make medical decisions on behalf of someone living with dementia. So it was part me being burnt out, part me seeing a problem, and then part of me also looking towards my future and
Mhm.
saying, I'm not sure that I want to work in the ER until I'm 65 years old. Maybe
Mhm.
I would like to do something different, and use my skills in a different way. So
Mhm. Yeah, no, that's great. I'd like you to speak a little to when you talked about sometimes not feeling so much like you're making a difference.
yeah.
So the first time a physician kind of said that to me was in response to I had shared actually it was a Kevin MD article, and it was a tribute to my doctors. It was probably the third article that I wrote, and I didn't name them, but I just listed all the ways that they went above and beyond. And I think I had called it lucky, unlucky, thankful. And he might have changed the title, but it was like, because of all the things that happened on the surface, it might appear that I was unlucky. But was I lucky because I had all these great doctors and I'm choosing to be thankful? So when I shared that post on LinkedIn, one doctor said that she goes to work, she's a primary care doctor every day, like not feeling like she's making a difference, and she was extrapolating from my thank you article that because I was so grateful to my doctors, that hopefully her patients, some of them are grateful to her, like they're just not giving her that positive feedback. And when
Mhm.
I read that, I was so like kind of surprised and sad. And I was like, oh my gosh, you could tell like she's a nice person, right? A good doctor going to work every day doing her best. And of course she is. And you also, right? You're going in every single day, like you save people's lives. So I just like you to speak, to that, to it's at the same time simultaneously knowing that you're literally saving people's lives and not feeling like you're making a difference, because that is it's not unique to either one of you.
Yeah. I mean, I think we also have to talk about how our brains kind of work in a way, right? So it takes, what is it, like 7 positive things to outweigh
Mhm.
one negative thing. So that's part of it. Your mind just holds on to negatives. And so when
Mhm.
someone is coming into the ER and they're angry that they've had to wait, or their expectation for what they want is not something that you can actually give them.
Mhm.
Or it's, for me, part of why I was so frustrated was because I'm thinking to myself, would this person actually want me to do this? Do
Mhm.
they actually want what we're about to do? And I felt like in a lot of cases, I don't know that they would. And yet I'm doing something to somebody and I don't really, I mean, I can't, yes, I can try to steer people in a certain way, but you have to ethically, you have to do the right thing and
Right.
listen to the family members. So for me, it's more of the system issues,
Mhm.
and feeling like the wins are there, yes, but the wins are so few and far between. And like what you said, we don't hear about them. Like people don't,
Mhm.
it's pretty rare that you save somebody's life and then they come back and say, "Hi, you saved my life." I mean, I can think of one instance. I have a crazy story that has like kind of fueled me to go forward in my journey in the ER, which I can share if you're interested.
Sure. Oh,
But
absolutely.
yeah, so I was working in our pediatric ER when I was an earlier attending, and it was towards the end of my shift. I saw this kid, he had fevers, he'd been on these antibiotics, and I said, "Ooh, there's this kid he either has meningitis or he has this big abscess in his neck, essentially." So I'm like, "So we're gonna CT him, look to see if he's got this abscess. If not, then I'm gonna do a lumbar puncture, whatever." And he wound up having this abscess and he had surgery and everything. So I caught it and I went home actually once we diagnosed the abscess, I went home and signed him out to
Mhm.
my colleague. But
Mhm.
it was so weird. My husband and I were in Europe, I think like a couple years later,
Mhm.
and we're on this bus doing a tour with the group. We were on a cruise, and I was just talking about where I lived, and somebody said, "Oh, I live there." Okay, that's weird. And then they said, "Well," like I said that I worked at the hospital, and then they said, "Well, what hospital?" I said, "What hospital?" And then they said, "Oh, that hospital saved my grandson's life." And I was like, oh, that's cool. And then she starts telling the story, and I was like, oh my gosh, I was your grandson's
Oh my
doctor.
gosh, that's
Yeah.
crazy.
It's not, it's so, that is nuts. Like that, I mean, I don't think things like that happen very often. But then like the family actually wrote me, like they sent me pictures of their child, like several years later, like this is the anniversary of, they credited me with like saving his life, which any good doctor would have done what I did, but
But
that,
it was you, so just take that in and don't say, you
yeah.
don't even say that, right?
Yeah, so I mean, we do make a difference. We do create impact, but I'll tell you, the system is so broken. There's so much
Mhm.
burden on patients, how
Right.
to navigate things. People don't understand what we can do and what we can't do, especially in the ER. People
Mhm.
can't get in to see their doctor.
Right.
They don't know when they should see a specialist, how long should they wait. There's so many problems in healthcare. And when you work in the ER, you just see all of the holes in it. And so it can
Mhm.
really really just eat at you.
Mhm.
So anyway, that was a crazy experience.
Yeah, that is amazing. It's almost too much to be believed. So that's
Yeah,
really neat. But that must have made you feel really good.
yeah.
And there's so many things that you said that we could speak to. And so I feel like that, yes, obviously some of the reason that, you have those feelings is the system,
Yeah.
there's obviously things have to change. And the other good point you raised is patient expectations,
Mhm.
that can help you, or, make or break how you feel about the experience, even though when you know what you're doing, it's kind of like that satisfied customer, but but you're a doctor, not a, whatever. What's the opposite of a consumer? What do they call you? Provider, right? No, that word provider is not for you guys. You're doctors.
Yes, we're trying not to be labeled as providers. Yeah.
Exactly. But I will tell you that since I was going through all my medical challenges, I started sending all my doctors thank you notes. And then my mom had went through some challenges and ended up at our local hospital. And I made sure to get the name of the ER doctor that we saw. And I actually did send her a thank you note. I'll have you know, because I think even it's like surgeons might tend to get the thank you notes, or maybe sometimes like a primary care doctor or pediatrician, but people don't think, because it's like you're in their life such a brief period of time, that they, in general, probably don't think to come back and thank you. So, and I'm sorry for that, because every day it's like, oh my God, like you save people's lives, you could figure anything out, right? And you save people's lives.
Sometimes.
So not to get, that gratitude, it's actually, pretty sad. So I just want to thank you on behalf of all the patients you've ever seen, because I know you're a darn good doctor and do your very best, and you deserve all the praise.
Thank you. Appreciate it. Yeah, we do the best we can. And it is, I feel like if people want to thank somebody who made an impact in their life, from the medical staff, writing a note,
Mm.
is a big thing. And we save them, like in the call room. And I still have that note that family wrote me. I'm moving. And so that's what made me think of it. I'm moving. And
Oh.
so I was going through all of my papers and I found that, and I hadn't thought about it in a while. So
Yeah, well, and actually, I recently interviewed Dr. Dawn Sear. She's a GI doctor in Texas, and we spoke. Our conversation ended up centering around gratitude, and
yeah.
it was almost like a show and tell. Like she actually showed me like some things that her patients have given her, and she showed me like a folder full of thank you notes and things like that. So that is, and I know for me, right, when I was practicing as a physical therapist, it really, yeah, it's very touching, and it really means a lot.
Yeah, that's what I feel like my online work has kind of helped me with that. I hadn't thought about that before, but it is a way for me to get I can do a lot, I can create a lot of impact with just teaching online. People who have never
Right.
spoken to me have written to me and said, you've changed, somebody recently wrote something about I changed the way that their person like passed away with like all of their family there, and that they knew that they should bring in hospice and these things, like they just made a difference in their life and their person's life just by like one thing that I said. So it's pretty amazing the impact that we can have now with online education. So
Right, right, exactly. And sometimes when you just like say a certain thing or spend time with one person, how it can really, really change things, right? And, more than you would think, and you're like, wow,
Yeah, the
Uh,
ripple effect, like you were saying with, I think maybe you said that today, or I was listening to something else that you said some point,
okay.
and how, you don't even realize the change that you can make, one
Mhm.
person tells somebody else and
Right, right, exactly. Those ripples of change that we talk about with Dr. Todd Otten.
mhm.
And he and I, and the power of 1+1, like we talk about that a lot, and it's really fascinating to watch. Um, so in going back for a minute to the ER, I understand the issues there and have like so many things, right? So like even things that people would go to their primary care doctor for, but now if they either don't have insurance or they would, because of a shortage of primary care doctors, they would have to wait 4 months to go to their primary care doctor. So you guys are seeing things that you never would have used to see and shouldn't
Mhm.
be seeing, right? Because they either don't have the money, or
Mhm.
or their doctor doesn't have the time to see them. And
Mhm.
that must be so frustrating, because you're probably doing everything from pulling out splinters, right? To dealing with maybe more people with mental like health issues or addiction, like things like that, that
Yeah.
really aren't directly shouldn't be handled by emergency. It's not what it was intended for.
Yeah, yeah, we definitely do some things that are more primary care. And I think there is a ton of mental health screening stuff that comes through the ER, and trying to help people get into treatment can be challenging because finances oftentimes come into play with that. But yeah, I mean, I think it's a little bit frustrating sometimes when we see something that really ideally you're making an educated best guess and kind of managing it, and
Yeah.
you would benefit from being able to communicate with that patient over time to see, okay, well, did that work? No, it didn't, so let's try this. And that's, I think, when I think about, the first thing that comes to my mind is rashes, like odd rashes that people have,
Sure.
or managing like a skin infection or something. And so it's, it's very frustrating that people can't get into primary care. But I also feel for primary care doctors because they, it's a hard job. They have
Mhm.
to see so many patients in order to keep
Right.
the lights on these days, because I mean, no one wants to reimburse physicians for talking,
Right.
for doing procedures and doing things to people's bodies physically. The reimbursement is very high for physicians. But when you have a physician whose job is to use their brain and to help you navigate through what's best for you and make the right choice for you, it takes time to do that well, and the compensation isn't there. So primary care doctors just have to see so many patients, and I feel like
Mm.
it's really compromised patient care. So I'm hoping more primary care physicians will do like direct patient care, and maybe we'll have a pendulum swing. But it's all fine. It's all money.
Right, right.
It's all
No, I
money.
fully agree with what you're saying, and we need to value our primary care doctors more. I mean, I wouldn't trade mine for $1 million. And you're right, it's the proceduralists or the specialists, that their incomes tend to be higher. And
Yeah.
it's the primary care doctors, though, they're ones, that's a specialty itself, though, that they're checking lab numbers in the morning. They see patients and put out fires all day. Then they're
Hmm.
checking lab numbers at night and responding to messages. And so
Hmm.
I appreciate my primary care doctor to the moon, and he knows it. But we have to all, we have to raise awareness and make sure that something gets done about it.
Yeah, and that's part of the reason too. Like, I was a little bit frustrated about why I decided to do the work I'm doing, is because I feel like ideally you would sit down with your primary care doctor as a family
Mhm.
or as an individual person who's aging, who's living with a chronic illness, and kind of think about, well, what does my future look like? What's okay and what's not okay? But primary care doctors, I feel, don't necessarily have the time to do
Right.
that. And then now also, because the way that the system is set up, primary care doctors don't often come to the hospital to take care of their patients,
Right. Right.
right? So we
Many
have
people.
hospitalists who
Right.
are, internal medicine physicians who take care of patients inside of the hospital, and they don't have the benefit of knowing the person.
Right.
So there's this big hole in connecting who the person is as an individual. And then when
Mhm.
something bad happens, or we're trying to navigate what is okay and what is not okay from a medical standpoint inside of the hospital, you don't have that primary care as an advocate, as a guide for the
Mhm.
patient and the family. And so, and also because they don't come to the hospital, they don't have the conversations as much anymore about should we start this treatment, should we not start this
Right.
treatment. As an ER physician, I'm a little bit different because I treat from cuts and scrapes and splinters all the
Yeah.
way to dying. And
Right.
so any type of critical care that somebody might need, where we're having to do something right now, or they might have a worse quality of life, or they might die,
Right.
I know what needs to be done. It's like, even
Right.
if I don't do it myself, the
Yeah.
procedure or whatever, I know who to call. I know what needs to happen. So I feel like we're in a position as hospital physicians, hospital-based
Mhm.
physicians, to be able to educate patients about thinking about their medical future and what their risks
Mhm.
are. And that is a little bit different than what primary care has evolved into being these days. So that's
Right.
just it's just interesting how things are changing and how things have changed in healthcare.
Right. Well, and even things that impact your decisions that have no business impacting your decision, right? Because I even know there's a whole thing when there's so many people coming to the ER and there's only so many beds and you have pressure to discharge them or move them to a room and there aren't enough, beds and all those kind of things. And it's like, you know what you want to say and do, right? And that's where that moral injury comes in. And sometimes you're
Mhm,
forced to make decisions that you
mhm.
don't think is necessarily in the best interest of the patient, because it's kind of what's being handed down to you, or you know what the expectation is, right?
Yeah, you don't have time to reset or educate.
Mm-hmm.
And because you don't have time to do that, a lot of times people just get the standard of care, which the standard of care in medicine is to do things to people to keep them alive, to protect their quality of life until
Right.
we're told otherwise. And for most of our lives, that's totally fine. But when somebody starts to value their quality of life more, or in the case of someone living with dementia, who we would interpret that they would value their quality of life more, it makes it much more challenging to do this decision making in real time. So that's
Mm-hmm.
why I'm advocating, because the system is so overtaxed and burdened, and it's hard to get access to knowledge in real time to make decisions. I really encourage people to start thinking in advance about the types of decisions that they might have to make for themselves or on
Mm-hmm.
behalf of somebody else. And if somebody is making medical decisions for someone living with dementia, they should know that I exist as a resource. I
Mm-hmm.
do a lot for free, but I also have my
Mm-hmm.
course, which
Right.
I'm this year. I don't know if I told you this, Kim, but this year I am personally analyzing the person living with dementia's medical history. So
Oh, okay.
I teach my clients how to gather the information that I need. And then, of course, it's all depersonalized. I'm not looking through their actual
Sure.
medical records or anything, but they
Okay.
send me back this document and then I record my thoughts. Like, these are
Right.
medications you need a plan for. These are situations your person is very at risk for. This is what you need to pay attention to inside of my course. These are the lessons you have to watch. And then I kind of help them with some like emailing and kind of supporting them through the course. So of course I raised the price because I'm individually involved now,
Sure.
but I'm really excited about being able to work with people and make sure that they're set up for success.
Right. And
But
that's what you originally wanted to do, right? So you feel like you found a way to
yeah,
educate people the way you want it to be done. So,
yeah. And I mean, it's evolving over time. I'm as a physician, this is
mhm,
my business and it's my passion. And maybe one day I'll wind up doing this full time. But
mhm.
yeah, I'm like I'm very lit up by it. I'm very excited about it.
That's great. And what we've been talking about, and I can't remember when, in our conversation last summer if it came up, but the work that you're doing reminds me of Atul Gawande and that book Being Mortal. Did we talk about that?
Yeah, I think you
Maybe
may have
last
mentioned
summer.
it. So
And that,
good
right,
book.
his book. So I highly recommend, also, his book is a compliment to what you do.
Yeah, I think it's a good way to think about things in a different way. And we should all be a little bit more open about talking about what life and living mean to us as people. Because if you are in a situation where you can't speak for yourself if your friends or family know what living and what life means to you, it will make it easier for them to make medical decisions on your behalf, you know? And it's much easier to go from that than it is from trying to guess those things about somebody, in the
Right, and
moment.
I think it must be difficult for doctors because I think a lot of them, and he might have even said in his book, like, that you guys wouldn't choose to have done to you, right? If you were in the
Mhm.
state of some of your patients, you wouldn't choose to have done some of the things, even with his dad, right? I think it ended up, it was a domino. It's things they didn't want to happen. It was a domino, and I think his dad was a physician as well. And
Yeah.
I think that might have been part of the reason he wrote the book.
Yeah, I can't it's been such a long time since I've read it, but I remember it really speaking to me when I read it. It is true. I mean, as a physician, I personally like have a bias towards less aggressive care
Mm-hmm.
if I would say my quality of life is not good, you know. And but the thing is, like, as a physician, I also have to keep in mind that I don't get to say who has good quality of life
Mm-hmm.
and who doesn't. Like, it's
Right.
not my role to judge whether or not you have good quality of life. So
Mm-hmm.
it's empowering people to start thinking about that for themselves and communicating that. But if you are the decision maker for someone living with dementia and they can no longer engage in that conversation, you still have to do that work for them because
Right.
you still have to make their medical decisions, and everything goes back to what would they say about their current quality of life? Because if we think that we can keep them at it, that might change
Mm-hmm.
what we do. But if
Absolutely.
we know with whatever treatment options we offer, they're not likely to get that quality of life back, or it's likely to get worse, that may change what we do.
Right.
So yes, like I would personally want way less care, and I
Right.
will make sure that it's very well documented. I need to
Right.
actually do that.
Yeah.
But,
Yeah.
but what I try to do and what I teach is just give people access to as much of the information so that they can really understand how things work. From a
Mhm.
medical standpoint, like if there's a medical problem, here's the most aggressive treatment to the least
Right.
aggressive treatment.
Right.
And this is kind of what goes in line with the different goals of care that people typically have. So it's like empowering people to make their own choices,
Mhm.
with access to information from someone who knows about those about those
Yeah,
things.
exactly. No, I agree with you. Yeah, 100% everything that you're saying. And thank you for sharing that. So as we start to wind down, if there's anything else you want to say about your online course and or if you have any top tips you'd like to share for your colleagues from seasoned physicians to medical students or even those considering med school.
Yeah, I think that gosh, I think that as physicians, you know, we have access to this wonderful knowledge. It's amazing the things that we learn. And I think reminding yourself of that as you go through the journey can be really helpful. But also reminding yourself that you're gaining skills and experience that you can use creatively in other ways. And
Mhm.
that just if you're unhappy with the pathway that you've gone down in medicine, there is another pathway. So the
Mhm.
first thing is like, I'm not happy.
Mhm.
What do I have at my disposal? What resources do I have? Where am I at in my life? What do I want? Like, can I find someone to help me work through what exactly I want? Because there's so many different pathways to go in medicine. And some people go to medical school to get all this knowledge and then they don't even use it as a physician,
Mhm.
you know?
Mhm.
So there's just, but it's people who are attracted to learning and science and medicine go into becoming physicians, right? So
Mhm.
but anyway, I just feel like from that perspective, it's like I want to offer a message of hope to people in healthcare that you don't have to get pigeonholed and stuck. You can find your way out and do something different. And then I also want to say to people like, please, please, please talk to your friends and family about what living means to you. Because if you literally do nothing else, that will help them be able to speak and advocate for you. And do I recommend that you name a person to be your medical decision maker, like in a medical power of attorney form or whatever it's called in your state? Yes, absolutely.
Mhm.
Please, please do that.
Mhm.
But yeah, that's pretty much it. And if anyone wants to connect with me, you can go to my name's Brittany Lamb. So if you go to blambmd.com, that's my website. And it has my blog on there and links to connect with me. And you can learn about my course there. The course is blammd.com/plan. So it's called Make Your Plan with Dr. Lamb.
Yeah, I love that. Well, thank you very much for being my guest today, Brittany. I think we've talked about a lot of really important things here that will resonate with a lot of people. It's important information to get out there, and I'm so happy to be able to spotlight you today.
Thank you, Kim. Thank you for having me.
You're welcome very much. So in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.